Welcome to Therapy Facts with Dr. Jenn. Today we are talking about the interview between Shannon Sharp and Amanda Seales at Club Shay Shay. Point number 3 is planned capitulation. In the interview, Amanda Seales talked about recently being diagnosed with autism spectrum disorder. We have talked about how autism spectrum disorder is a spectrum or range of characteristics or symptoms that may be different for every individual who has the disorder. Now, it is important to say that Amanda's experience of going her entire life of 42 years and not being diagnosed is a very common experience because African American girls in particular are the least likely or among the least likely to be diagnosed with autism spectrum disorder. And so it is not unusual for African American women in particular to get to adulthood without having been previously diagnosed. It is also possible to get to adulthood without being previously diagnosed because there was not a lot of diagnosing going on in the last 30 or 40 years in general because of the sometimes subtleness of the symptoms. And so, of course, there's been more diagnoses recently, but for someone who's 42 years or older, that they were not diagnosed is not very unusual. Also, when you add a high level of intelligence to the profile, it is very easy for people to simply decide that the person's odd or inappropriate behavior is intentional. And Amanda herself talked about how so many people in so many situations responded negatively to her very natural behavior and personality characteristics. And so, as a result of people attributing her behavior to her choice, then she would have been very unlikely, and also with her intelligence, she would have been very unlikely to have been presented to a mental health professional for diagnosis or a medical professional for diagnosis of a disorder that was not very well understood when she would have been coming through childhood and adolescence. And so her experience is very common in terms of the late diagnosis or the never diagnosis for autism spectrum disorder for African American women in particular, girls and women in particular, and then for people 40 years or older in general. And so Amanda stated and described various instances where she found herself in a situation of social difficulties and communication difficulties where people gave her the credit for intentionally behaving in those ways that would have been offensive, although that was never her intent. And in fact, she used the platform to do a blanket apology and say, hey, if I've ever offended any of you out there, that was never my intent. However, because when in social situations, people ascribe intent to the actor, then people have challenges like Amanda described. Now, Amanda's challenges with social interactions and social communication are not necessarily unique for people with autism spectrum disorder. There are plenty of people who have challenges with social interaction and communication skills who are not on the spectrum, as they would say, who would not have symptoms that put them at the level of diagnosis for ASD. However, Amanda's difficulty with being able to take turns and to engage in deference, even with peers in her social interaction and her communication style, is more common among people than thought. In my practice, I notice very often that that clients will have communication challenges, will have social interaction challenges, especially with either authority figures like their supervisor, their boss, etc., or someone who is adjacent to their supervisor or boss. And instead of realizing that deference is needed in both situations, they continue to stand their ground and hold their position to the detriment of their goals. So let me say that again, that people tend to hold their position and stand their ground to the detriment of their goals. Now, notice what I keep talking about in the common theme through the video series is being able to behave in ways that allow one a choice so that you know how to be deferent or you know how to fit in if you choose to fit in, right? And so in a situation where one has decided that they're going to stand their ground and and they are sacrificing their goals, one must ask oneself, is this my choice? Is sacrificing my goal worth me standing my ground? Now, someone with autism spectrum disorder has a real hard time weighing those two things out. Their default is going to be to stand their ground, to do things in the way that makes them comfortable, because they don't always look ahead to see that they're not able to look ahead to see how this will impact them. The behavior in this particular situation can impact them in another situation. And so, for example, Amanda talked about having an issue with the publicist of someone she worked for. And in her mind, the person she worked for was the boss, and she was cool with treating them as such. But she was not okay with treating the publicist as such. And in fact, did not. In fact, held her ground and did not give this person the deference that they were looking for. And so as a result, they ended up bad mouthing her and putting her in a position where she lost exposure and opportunities because of this person's response to her lack of deference, lack of proper respect for her position adjacent to power. And now we know that that is a tale as old as time. And even people without autism spectrum disorder find themselves in that same position over and over again. And so in my practice, I talk about planned capitulation or planned surrender. Now, planned surrender on a micro level is to be able to say to someone, you know what? Your point is valid. However, this is how I saw it. That's a micro level of planned capitulation. It's surrendering and saying, hey, my point or my perspective isn't the only right perspective. It might not even be right. It's simply my lived experience. Your point, your thought, your idea is valid as well. That's micro level. On a more macro level or a bigger stage is to give the deference and the propers, as we would say, or the proper respect to those people who are adjacent, who are in power, who can make decisions that impact your goals, whatever your goals are, whether they're to advance your career or simply to feed yourself. To give deference to the people who are in power, but also deference to the people who are adjacent to the power, who are able to access the power and then to influence outcomes for you that are related to your goals. Because we can talk all day about how someone is wrong, truly. But we have no control over anyone except ourselves. And very often, what people want from very smart people and people who are on a mission, if you're on any positive mission of any sort, you're going to meet people who want to create some friction for you. And what those people are looking for is deference. And so being able to get in your mind that, hey, I'm going to practice surrendering to people who want me to show them a level of respect that I may not necessarily feel they deserve, and maybe they don't. But I'm going to get in the practice of being able to give people that respect, that deference that they're looking for without it costing me so much and without it selling me out. Now, of course, I'm not suggesting that you sell yourself out, that you compromise your integrity, because I'm a big integrity person. Don't compromise your integrity. Don't compromise your sleep. Don't compromise your safety. Don't compromise your mental health. However, without doing any of that, if you can find a way to give people, especially people who are adjacent, there are some people who flat out won't give respect to their boss or supervisor or the person in charge. They don't care. But there are also people who are not going to give that respect or that deference to people who are adjacent to power and find themselves in a world of hurt because they weren't able to take a step back, give people the respect that they're looking for, and then move on toward their goals. So let Amanda Seales experience, even though she has autism spectrum disorder, let her experience inform your ability to learn planned surrender.